Okay, I'm going to go ahead and get started. First of all, welcome everyone to Every Child's, I think, final Parent Up Pittsburgh webinar. We really appreciate you being here early in the week and in a short week. So we really appreciate you taking the time to be with us. For those of you who aren't familiar with Every Child, I think most of you probably are, judging by some of the names that I saw, but we are a social service and behavioral health organization based in Pittsburgh, and we serve kids and families in foster care, adoption, community-based behavioral health, and family prevention services. And we've been around for about 20 years. One of the reasons we wanted to have Parent Up is we became aware of so many experts, either through our work in the field, through working with them, collaborations, that we really wanted to bring all the expertise that we had access to a broader community. And we thought, what better way to do that than through webinars that are free and people can log in at the end of their day and hopefully learn a little something to up their parenting game. And so we've been doing this since September. I think it's been pretty helpful. And we're really excited to have you all here. A couple of housekeeping things. If you could, make sure you're muted if you're not talking so that we don't have a lot of background noise. If you have a question, you can certainly unmute and ask. It may be a little bit easier for you to put the question in the chat, and then we'll moderate and make sure we get your question out. So before I introduce our speaker, I do want to also thank our sponsors, which we could not do this event without them. Our presenting sponsor is NAMI Keystone Pennsylvania, and our champion sponsors, Highmark and Allegheny Health Network, and also Kenny Ross and the Wilson Group. So thank you to all of our sponsors for making this possible. I am really pleased to introduce our guest this evening, Dr. Anna Radovic. Dr. Radovic is an assistant professor of pediatrics at the University of Pittsburgh. She is a pediatrician and subspecialist in adolescent medicine, and she completed her undergrad and medical school at Case Western Reserve University in Cleveland. Her pediatrics residency in adolescent medicine fellowship was completed at the University of Pittsburgh Medical Center, and she also has a master's in clinical science at the University of Pittsburgh. Her practice focuses on how to use technology to improve mental health services for adolescents with symptoms of depression or anxiety. And she has also studied primary care provider attitudes towards approached shared decision-making with parents, the use of electronic order sets and screening decision aids to improve the integration of behavioral health services in primary care settings, and the impacts of social media and technology use in depressed adolescents and their parents. And that's really why we asked her to join us today to talk about the impact of social media and technology on kids and families and how to navigate that balance, since it's become such a huge part of our world and our kids' worlds. So with that, I would love to introduce Dr. Radovic. Welcome.
Thank you so much, Laura, and thanks so much to Every Child. When I was a pediatric resident, I actually came out to visit with our community-oriented resident group and saw what amazing work you were doing. So thanks so much. Okay, I'm gonna share my screen and let me know if this works for the PowerPoint to present. Is that working out for you?
Yes.
Okay, great. Okay, let me know, just like feel free to interrupt me if something goes wrong with the audio or video or anything. Okay, so thanks so much for having me. As you know, we talked about, I'm a pediatrician and I am a subspecialist in adolescent and young adult medicine. So I just wanted to let you know about our clinic at UPMC Children's Hospital, Pittsburgh. We have a clinic in Oakland and in the South Hills and the North Hills. And we also have providers who are embedded in some of the primary care practices. And we see young adults and adolescents up to age 26 we can be their main primary care doctor, and we can see them for a lot of different things that come up during adolescence. So part of my role there is talking to young people about their mental health. I don't have any conflicts except this is a book that I worked on that informs some of this talk that I don't get anything for anymore, just a tiny stipend in the beginning, but I just want to throw that out there. Today we're going to talk about, first, to start off with, how do you recognize signs and symptoms of mental illness? What are some positives and negatives of social media use and its relationship to mental illness? And then at the end, I'll share some resources. So first of all, we're going to talk about recognizing some signs and symptoms of mental illness. And just to recognize, any kind of parenting, especially during this COVID pandemic, is very hard. This is a University of Michigan lab study about parents commenting in general how worried they are about life right now, whether social isolation makes it difficult to parent, financial concerns, feeling sad, feeling lonely. So this has been a difficult year for parents, and none of what I say is foolproof. And my kids are, to be transparent, 9 or almost 9 and 6. So I don't have teenagers. I just tell parents how to parent teenagers. So I know it's very challenging, but hopefully some of the things I tell you might be helpful. So adolescence and young adulthood is a time of emotional change. So we know, babies should be learning how to walk. There's all these developmental milestones your pediatrician will ask you about. Well, adolescence is actually the time where you get emotional milestones. So the brain is really rapidly developing. It's actually very amazing because there's this huge opportunity of what the brain can learn during adolescence. We used to think, oh, only babies 0 to 3, that's a time of rapid learning. Well, so is 9 to 14. And in addition to learning things you might learn in school, facts, figures, you're also learning about how to cope with your emotion. And it's not what we used to think that, oh, well, part of their brain is developed, they can't make good decisions. That's not true. Actually, their brain is wired for risk-taking. So when teens are in a kind of a boring situation and you sit down with them to talk, they actually can make really well-informed, good decisions. But when they're in a situation where they could get a reward, like something good could come out of them taking a risk, even though they know it's a bad idea, they're going to take that risk. And their brain is wired that way so that they don't always live at home, but so they kind of get out on their own, become independent. And so our job is try to give them healthy risks to take so they don't take those unhealthy risks. And this is a chart that shows different mental illnesses and what ages they develop. So on the bottom horizontal axis, you can see age from 4 to 18. And you can see on the vertical axis what percent of young people have that problem. So the red line is anxiety, and it's showing that anxiety starts to show up when you're younger. So kids might be afraid of leaving their parent, of talking to other kids, monsters under the bed. Some of those things are normal, some of those things get to be too much. But the blue line is behavior problems, things like ADHD, being oppositional, those start to show up as well. The green line is mood, and the purple line is substance. So we don't see mood and substance issues start to approach adult levels until around 11, 10. That's when they start to go up. So this is the time period in adolescence where we first, for most young people, first start to see depression. And just in general, when we talk about behavioral health, what does that even mean? So when we talk about it, it means mental health plus substance abuse and addictions. So there might be overlap between the two, there might not be. I'm going to talk to you about mental illness defined as conditions that involve changes in thinking, in emotion or feelings, and behavior, and what other people see that you do, or a combination of those. And the thing to know is that for every mental illness, there are two things, either one of which has to occur to say that it's a mental illness. So it has to be either associated with distress, so that internally that person feels really poorly about their symptoms, or with problems in functioning. So what are the tasks of kids? Going to school, having relationships with friends and family, one of those two things. And something to remember is some people are high functioning. So they look like on the outside like everything's getting done, but actually they're inside experiencing a lot of distress. And so there are many types of behavioral health problems I have listed here. And it can be difficult to figure out what's going on with a teen, because a provider you see might be getting a snapshot of that other graph where maybe they have a few symptoms of this and that. And when they become an adult, everyone looks back and is like, oh yeah, all along it was this problem. But it can be hard in teens because we need some more information, some more time to go by to really figure out what's going on. And as you know, there are no blood tests that we can order or things like that. So it can be difficult to make some of these diagnoses, and there's a lot of overlap between different things. A bit easier is to make a diagnosis of an externalizing disorder. So if a kid has ADHD and they're very hyperactive, their teacher might be noticing that they can't stay in their seat when they're at home. The other family members are noticing that as well. That's kind of hard to ignore. And those kids end up getting those diagnoses more often. But internalizing disorders are more what's going on the inside. So this boy may feel very angry at his friend, but he's not telling him. He's just having angry thoughts that he's not expressing. And irritability is actually a sign of depression in teens, where for adults, it's not part of the diagnosis. So these are the difficult ones to pick up on, because you might not see anything on the outside, and that's all you have to go by. I'm going to talk mainly about depression and anxiety, which are some of the most common problems that we see in adolescents in terms of mental illness. What depression is it's defined by this mood. So you have to have either feeling depressed, sad, or irritable. Then you lose pleasure or interest in things you used to like. So for a young person, it's normal for them to lose interest in their parent. And it might be normal to lose interest in one friend group. But to lose interest in all friend groups and just want to be alone, or lose interest in things they in general like that they used to love and not have any interest at all, that's not something we'd expect. And feeling worthless, hopeless, guilty, like everything's their fault, they caused all their problems. And then with thinking, you can have trouble concentrating, making decisions. We're going to talk a little later about suicidal thoughts. And then in terms of body, sometimes we as physicians will see someone because of feeling tired, sleep issues, eating problems, and it could be that those are signs of depression. And like I was saying, you might not know that someone is depressed by looking at them. When you Google depression, you see all of these obvious signs, right? That you're going to walk by a teen and they're going to have their head in their hands, sitting on the corner of a wall. No, not necessarily. So this kind of imagery that we see for depression in different articles is just not true. Someone might be looking like they are the happiest in the world, and on the inside they're feeling really, really bad. And for anxiety, so anxiety we can categorize into emotions. So being fearful, everyone's scared of something, but are you scared out of proportion to the thing that it is? Okay. Are you on guard? And the body responses you might see are things like increased heart rate, sweating, feeling short of breath, muscle tension, stomach upset. So this is something physicians can see a lot, like headaches, belly aches, chest pain, and then having thoughts about that there's a real danger. I can't stop thinking about this danger. And whatever that danger is might not be a danger to someone else, but to that young person, it feels like this is something that, my life is at risk because of these worries. And then the behaviors you engage in are things like avoiding that danger. So if it's social situations, avoiding them. And then unfortunately, self-medicating can happen, especially with alcohol or marijuana, which, they can help with anxiety, but they're not without side effects and consequences. So one thing I like to talk to parents about is it's not something you have to figure out on your own. Like I'm explaining, it's very difficult to figure out, is something just part of this emotional brain development, or is this something that I should be worried about? You don't have to wait until you get into a crisis situation, because that's a role that a primary care doctor can play. So primary care doctors in pediatrics, we're supposed to do these prevention checkups. Luckily, kids don't get very sick. What we do is we talk to parents about, are they in their car seat the right way? Are they wearing their bike helmet? We're doing a lot of prevention. In teens, that's emotional prevention. So are they sleeping okay? Are they having any of these signs or symptoms? And now more and more providers are using screening questionnaires, and some of them actually have therapists in their office. Sometimes that therapist might not be someone that has the capacity to see someone every week, but they can be helpful in giving you feedback like, well, actually, we do think there is possibly a depression diagnosis here, versus, oh no, it's just, something that getting better sleep would help with. And some providers are comfortable with prescribing antidepressants, but they can also refer to other resources, and they can assess for physical health complaints. So in state of Pennsylvania, we're fortunate because we have access to a child psychiatry network called TIPS. So I can, any day of the week, call them up and get their advice. So instead of my patient waiting 3 months to see a psychiatrist, I can get all the information and call the psychiatrist to help me make a decision. And this is an example. So Mental Health America has a bunch of screening tools people might take on their own to kind of give them an idea. But so this is a screen called Patient Health Questionnaire 9, modified for teens, which we typically give to young people where we might be having symptoms of depression. Now, that comes with an important key thing is confidentiality. So young people's confidentiality is actually protected with their primary care provider. This varies state by state, but in Pennsylvania, minors are less than 18 and they need their parents' consent for any medical care. But if it's something that they can get care for by themselves and consent for by themselves, they can get that care confidentially. So one of those things is diagnosis and treatment of mental health problems for minors 14 and older, and substance abuse treatment. That means a young person could come in and get therapy for themselves or medication without their parents' consent. That doesn't necessarily happen because young people need parents and guardians for other things, like they need them to drive them to the therapist or pay for the medication or whatever that is. But and if teens tell us about suicidality or self-harm, then we're obligated to get families involved. But sometimes if you have a worry and you feel like, this young person might not be telling me something, when you take them to that provider can be somebody who can establish confidentiality with that young person so that maybe they feel comfortable sharing something like, well, I've had thoughts of self-harm, I haven't done anything yet, and I'm not sure how to cope with this. Maybe they don't want to tell you that, not necessarily because they're keeping things from you, but they don't want you to burden you with their problems because they feel guilty for what they're going through. But that provider, that's their job. So that provider might be able to be a bridge to help you know, is there something going on? And should I connect this young person to treatment? And then they might get what they need, even if you don't know kind of exactly how that happened in terms of what like the specific things are. And then what can happen from there is that therapist works with them and with you to help them open up to you more. So it can be a process, and the provider can be helpful. So what things have been proven to help with depression, anxiety? Definitely psychotherapy. I'm going to talk a little bit more about what cognitive behavioral therapy is, which is one of the most evidence-based methods that we recommend. There's also interpersonal and problem-solving therapy. Medications can help, like antidepressants, and then other in general things like having good social support. Sleep is super important. Nutrition, relaxation, meditation can be helpful, and definitely exercise. So CBT is basically at least 6 to 21 hour weekly sessions. It can be every other week. And you're really focusing on thoughts, emotions, behaviors, and how those are connected. And therapists are the technical experts. So they're the ones who know all of the skills to provide, but the patient's really an expert on themselves. So they're saying, here's some of the scenarios I find myself in, and the therapist is offering those skills. So it's more like a coaching, push-pull relationship where, okay, try this skill, did it work, why not? And then that young person discovers, hey, I can choose more positive thoughts and behaviors. This is an example of just like a comic strip of what might happen. So there's an event that happens where Jude says hi to Destiny. She just keeps walking. She doesn't say anything. And anybody who is observing the situation would say, oh yeah, that's definitely what happened. She walked away. There's no arguing that that happened. But what can be different is how Jude thinks about that situation. So here Jude is saying, wow, she just doesn't want to say hi to me because she thinks I'm a dork like everyone else. And this is a negative belief. What happens then, his emotion is he feels sad and upset. And then what happens, she asks him, hey, do you still want to be lab partners? And he says, no, I already have one. He doesn't want to be burned again, right? The next situation, same thing happens. Everyone agrees that she walked past him. But now his thought is, oh, it seems like she has a lot on her mind. I know she has a math test today. And he's thinking more rationally. He's having a more well-balanced thought. Could be a good thing, could be a bad thing. And then his emotion is that he feels just fine, not a big deal. And then his action is when she has to be lab partners, he says, oh, no problem. You know, she says, I was sorry, I was stressed out about the math test, and that's fine with him. So this is kind of scenario where you show young people they can change their thoughts into positive ones by really reflecting a lot about what's behind my thinking. Antidepressants, we prescribe for depression, anxiety, but they're more effective for anxiety. And whether to start them really depends on how severe the symptoms are and the treatment preferences. Everyone has different preferences about what they want. And usually there's not a right or wrong answer. One thing to note, which some people miss, is that it can take a month to show an effect. It kind of stinks. You have to wait that long to see if it's helping. But it's important not to write it off too soon. And then if it's not helping, that's fine. You don't have to keep taking it. But if it is helping, it's actually important to continue taking it for about a year. Because if you stop it too soon, then you can get a relapse. So some people say, oh, actually, I'm good. I don't need to keep taking this, especially some of my college students, and then they come back and they're worse. Sorry, it's like getting hotter, so I have to have some more. Okay, sorry about that. So I just wanted to go through myths or facts. It's not like very interactive, so it's hard to go through this, but I'll just read these out. So one, taking medication is not going to solve the problems in my life. Myth or fact? So it's a fact. It's right. Your young person's choice to start a medication is one of many steps they take. And so everyone I have who's on medication only, I continue to talk to them about what about therapy? What about other things you could do? Some people think I'll definitely get a terrible side effect. That's a myth. It's not definite. You might get a side effect, and most often it's not terrible. The first few weeks, like I said, are a trial run, and no one should force them to take the medication if they get a side effect they don't like. There are a lot of other medications they can try. These medications are addictive. So that's a myth. They're not addictive. You don't experience a high, but you do have to decrease it slowly, because if you don't, you can get side effects. So it's really important to be taking this with a provider involved in helping you make decisions. Some people have a harder time stopping an antidepressant because they feel more anxious or depressed as they're stopping it, but that's not most people. If I need medications, that means I'm a failure. So a lot of young people feel this way, like, I just started becoming a teen and going to be an adult, and now look at all this like emotional help I need. Well, this is a myth. For some people, medications can help treat their depression, and it's a medical problem. Just like asthma is not someone's fault. They may need albuterol to treat their asthma. Someone might need medication to treat their depression. Antidepressants would definitely change my personality. That is a myth. So some people might experience more of a muted mood, so they don't have as highs and lows. And if it's something someone doesn't like, then you can try a different antidepressant. So it's not something that you're committed to if you don't like it. My family wouldn't want me using these types of medications. So it's something that teens think, and they might not realize that some of their family members might also be taking antidepressants. So it's something to talk about with them before that visit, if you feel comfortable that there are other adults in their life that they might not realize are taking antidepressants. And only really messed up people need medications. That is obviously a myth, because taking it is an important health decision, and someone who's trying to reach their goals might want to take an antidepressant because it helps them. It's not giving up. It's a strength that you're making treatment decisions for yourself. So one of the things I focus on in my research is that there are a lot of people who might not want to ask for help because they are worried about a lot of different things. When we think about youth who might have been in the foster system before, some of them have had a bad experience with trying to get help or getting help before, because it was something that felt like a punishment, like mandated, you have to do this. And if you can get young people involved in making that decision, or kind of take ownership of that therapy relationship, like say, meet with their therapist and say, these are my goals, these are the things I want to work on, therapy ends up working better. But it can be tough when you haven't had a good experience with it before. And then some people don't think it'll help. They should figure it out on their own. They don't want anyone to find out. Some parents that I've interviewed before, they feel like there's nothing wrong with it, but they're worried about what other people will think. Will other people think that I'm not doing a good job parenting because my kid needs help? But little do you know that, or maybe you do know, that we see a lot of young people who need help. About a third of them might be experiencing anxiety in their lifetime, and about 14% may be experiencing depression. So no one should be blaming the parent that a kid has asthma because, maybe it's contributing that they live in a city in Pittsburgh. Maybe they should have lived in the country. Why are they living in a city, around all this pollution? It's kind of along the same lines. So no blaming. Okay, so when we look at, why as a physician do I care about mental health so much? Well, actually, suicide is the second cause of death, unfortunately, in adolescents and young adults. And unfortunately, it has been increasing. When we ask young people in high school how many of them have felt depressed, about 30%, females more than male. And there's some differences in race and ethnicity there. And then when we look at over the years, how many of them have seriously considered attempting suicide in the past year, it's 17%. And that number has been growing. It's still around 17. Unfortunately, about half of gay, lesbian, bisexual students, and I think even numbers are higher for transgender students, although I don't have that here, and 30% aren't sure about their sexuality, seriously consider attempting suicide. So it's a huge issue in this population. about 7% attempt, and in 2%, this actually results in injury. So not everyone who has suicidal thoughts has a depression diagnosis, about half do. But others might have thoughts of suicide because they feel like they're a burden, they feel hopeless, isolated. It's in the context of drinking alcohol or drug abuse. There's a very stressful life event, or they were recently discharged from a psychiatric hospital. So even though it's very uncomfortable for us to talk about, especially in the context of a child you care so much about, it's something that's important for us to be aware about. And so suicide prevention, we all can have a role. If someone's talking about wanting to die, it's important to take them seriously. If they're looking up ways to end their life, if they say they're feeling hopeless, abusing substances, not sleeping enough, acting recklessly, and asking someone about suicide does not lead to suicide. So what can be the most helpful is just listening without judgment and reassuring them that what they're experiencing is treatable and suicidal feelings go away. I kind of tend to compare it like if you're really angry at someone and you yell at them and you say all these mean things, and then the next day you feel terrible and you realize had you cooled off a little bit, you would have responded differently. Similarly with suicidal thoughts, what can help is getting those emotions down to a level where someone can think a little bit more rationally about what they want to do in their situation. It's important to get help for a suicidal person. I'm going to share some resources. So one thing we talk about is doing a safety plan. And a safety plan is something that young people who have suicidal thoughts should do, and something they can do with their primary care provider or with a mental health professional, or on their own. They can start to think about what might they do. And they're basically steps for when you feel suicidal, how to get yourself down to a level where you can kind of think a little bit more clearly. And if you can't get yourself down to that level, how do you get help? And so you want to have some if this is something a young person has experienced before, why? So some young people have had conflicts with adults in their lives, especially parents. And so they might say like, hey, let's have, a code word that we use when things are getting heated or too difficult that we use, so that we just like stop, calm down, and approach this later. It could be some random word, something you think of together. Or if it's another warning sign, thinking through how to prevent that from escalating or kind of getting out of that situation. And then the second step is, what are things I can do on my own to cool down? Doesn't have to be something very fancy. It can be something like, okay, there's a video that I think is hilarious. It makes me laugh, and then I cool down. There's different distress tolerance techniques like opposite emotion. So if I'm feeling horrible and then I play a song and I make myself dance, sometimes that can snap me out of it. There's a method where you put your face into a bucket of ice water and it helps your heart rate cool down. If that's safe for that young person, it can be something they can try. Let's say none of those things work, then you go to step 3. Who are people that can provide distraction? Those people don't have to be someone the young person says, hey, I'm having these thoughts. It can just be somebody that is always going to be available to go take a walk or talk about something random or just watch TV with to kind of cool down. And then next, who are people I can actually tell and ask for help? And hopefully there's supportive adults who can do that with that young person. If they're not, the next thing to do is to turn to professionals who can provide help and crisis lifelines. You haven't heard of Crisis Text Line. This is a really great service where a young person can just text 741-741 and they can get somebody on the other line to provide support. And there's also Resolve that we know about, which you get to from the National Suicide Prevention Lifeline in Allegheny County, and other suicidal crisis resources. Sometimes it's nice for that young person to just like test out one of these when they're not feeling upset. just to get over the hump of like that it's okay. And unfortunately, we have to think through, okay, if they actually did do something, how would we prevent them from taking an impulsive action? It's really important, gun safety, because out of all the different methods someone might use to end their life, guns can be the most lethal. And there are a lot of different options of what to do. Some are more affordable than others in terms of keeping a young person safe. So having a gun locked or in a safe can be life-saving. Okay, now as promised, I'm going to talk briefly about social media use. Let me just get some water because it is kind of getting super hot. For some reason, this room in my house is very hot. Okay, I'm sorry. So it's not shocking to anybody that young people are online. And I used to use this picture before COVID. Now it's definitely not shocking that every kid is online and we're all online. Even before COVID, you can see that there was a huge difference between 2012 and 2018 in terms of how much social media young people are using. So 70% more than once a day. And then on the left, also video chatting had gone up, and in-person talking versus texting. Texting had beat out in-person talking. So these changes have been going on, and now they've skyrocketed with COVID, and there's no going back. So what do we do? Well, actually, despite some of the media attention to what is wrong with social media, in general, teens feel like it has more of a positive effect on them than a negative effect. They feel confident, better about themselves, they feel less lonely, especially during COVID, and not having access to seeing their friends in person. The issue is that teens who have low social and emotional well-being, they are the ones experiencing more of these negative effects. So on the left, you can see the dark purple are kids who have low social emotional well-being. About 70% say they sometimes feel left out or excluded, versus 29% who have high social emotional well-being. They're also more likely to feel bad if no one comments or likes their post. They've deleted posts because they get too few likes, and they've been more likely to be cyberbullied. So then, is social media use really associated with depression? Well, that's why I have this chicken and egg little icon, because there's some studies that look at kind of one point in time and they say, oh, okay, kids who use social media more often have more depressive symptoms. And then there's other big studies that have shown there's no association. So what we're really finding, the more and more research we do, is that it really depends who you're talking about, why they're using it, how they're using it. And understanding that helps us give people advice, because everyone's using it. And so one thing to know about depression is kids who feel depressed have cognitive bias. That means they're more likely to see the glass empty than full. And even in one study, they looked at objectively, like what kind of social media, they looked at the actual social media interaction. And young people who had depressive symptoms, in the same kind of interaction where like an objective person would say they actually got social support online, they perceived that they got less social support. And whatever happens online, they're interpreting it differently. They're feeling like it's more negative, and they feel worse comparing themselves to others online. So they have a worse experience, even though that experience other people might not rate that it's actually worse. And so some negative associations with social media have been having a negative self-concept, and feeling like they need to kind of share that with others. And then when people share negative things online, they're more likely to be kind of stepped away from. No one wants to talk to them. And then it's like a self-fulfilling thing, like, wow, I feel negatively, I shared it with people, I was trying to look for support, and now no one's supporting me. They can feel ostracized, and the more dishonest they are online, the worse they feel, and they feel they can be ignored. There's a lot of problems with body dissatisfaction, eating disorder, and problematic online behavior has been going on for a long time, even before social media. And so a lot of people are seeing kind of distorted images of what they think other people look like when that's not what they really look like in real life. And then another problem is that they kind of have their whole life online. So where my college photos are in a photo album in a drawer somewhere, I don't really think about it very much. Someone else might be triggered by constantly seeing their old photos pop up on their phone. And so some risk factors and unhelpful ways to use are, like I said, being inauthentic, letting it get in the way of sleep, sharing really everything about you, like sharing constantly, you know, other posting that can be triggering, like seeing something you weren't expecting that makes you upset, going online when you're stressed out, using a lot of the time, using it in negative ways, cyberbullying, seeing some explicit content, seeing content that's promoting self-harm or suicide, comparing yourselves to others, and then feeling like you don't belong. On the other hand, there are some positive associations with social media use. So people can feel more connected socially. It can be a place where they self-disclose things they might not have told anyone else. If they do that in a safe place, that can promote feelings of connection, and that can help you feel better. When you have a friendship with someone and you interact online and in person, it can actually be a higher quality friendship. Boys, a lot of times, are doing this interactive video game play. And sometimes your self-esteem can go up because maybe you're sharing creative things that you've done, like photos or music online, and getting positive feedback. Some people don't have access to certain social communities that they might be able to find online, and then they can emotionally express themselves. People who have social anxiety, can be a little less anxiety inducing to talk to others online versus in person. And then young people are trying to develop their identity. So it can be safer to maybe explore some of those things online versus in real life where there might be more consequences. And so the opposite of some of the risk factors are, you know, being authentic online, getting social support, feeling like you belong, getting social capital. So I'm going to college and I don't know what to expect, and then I meet some new friends who kind of tell me the ins and outs of this college, and creativity, social engagement. Some things that are more concerning are cyberbullying. So cyberbullying can be very difficult because the bully has 24/7 access. You might log off and there's continued harassment. It can go viral. Adults aren't seeing what's going on. It can be anonymous. But one thing to know is that there's evidence that family support can help. So young people going online, experiencing these negative things, if there's no buffer for them, it's a lot worse. So that they don't have real life friends who are saying, you know, that situation is weird. Like, people don't actually think that you're this or that, or you're fine. Then you have like real life evidence that there's people who really know you versus these online people who feel positively about you. That serves as a buffer in these bullying situations. And that's also family support. So thinking, where is the kid? Kid is in their family, they're with their friends, they're with their school. If those are positive relationships where they feel supported, that can buffer some of this online bullying that's happening. And there's a lot of great resources online, like stopbullying.gov. And so if this is an issue for you, going online and seeing what the laws are and what you can do can be helpful. Another thing I'm going to talk about is media multitasking. This is something that is problematic. So nobody can actually multitask. I'm giving this talk right now. I can't possibly also be looking at my phone and listening to music and watching TV. Same thing if I were trying to finish, if I was a young person trying to finish a homework assignment and write a paper. I can't possibly be doing all of those other things at the same time. So you think about, you're actually switching from one thing to another thing to another thing, and you're breaking up your concentration so much that you're not actually doing a good job. What happens is teens who multitask perform more poorly academically, they have less focus, they can have increased anxiety. And why are they even doing it? Well, if something is hard and it's frustrating and you feel bad, but then you feel good looking at your phone, like, oh, maybe somebody texted me, maybe I'll play this game. It's a quick escape. It's kind of like a little M&M bowl that you have, and you're just like, oh, I hate this. And I eat an M&M and I feel better and I feel better. But then I'm not actually getting anything done, and the whole situation is not solving itself. Maybe another better thing would be saying, hey, I actually need a break to go outside, or I need to kind of figure out, maybe get some more help in finishing this assignment or whatnot. And so it's better for a young person to do something on their phone for 10 minutes, do their work for 20 minutes. And sometimes I tell, where is it? I don't know where my little, sometimes I show young people having this like Pomodoro timer. So setting a timer and saying, okay, 20, maybe even 10 minutes, I'm going to do this work, and then 5 minutes on my phone is better than just having your phone during those 10 minutes. So we talked a little bit about this. It can have bad effects on sleep. That can be really hard to tell teens not to use their phone at night, but it can be helpful for sleep. And one thing to consider is our role modeling to our young people. So this is a chart showing, do teens' parents say that they actually spend too much time on their phone? And so on the right, you can see parents who say their teen is distracted. They're saying, 30% are saying they're often distracted, or 42% are saying sometimes. But teens are also noticing that their parents distracted. So it's important for us to try to role model the things we expect of them. And if we feel like it's not achievable, then it might not be achievable for them either. And that's part of what I kind of talked about here on this slide already. So one thing is, if a young person discloses they're depressed on social media, and let's say somebody lets you know or you see it, they've actually said, you know what, I don't want an adult to message me on social media or comment on my post or anything like that. They actually want to have an in-person conversation about it. And they want you to ask questions instead of making assumptions and follow their lead. So about sensitive topics, you might think that they want to talk on social media or over text, but they might actually just want to talk in person. And you can decrease miscommunication that way. So be careful about what you're talking to them about online. Sometimes in person may be better. So to close, basically talking to teens about their motives for using social technologies, promoting active connection with others so that they're actually getting good friend social support. Even if it's online, it's better for them to be doing one-to-one video chatting than just talking to a bunch of strangers. And then encouraging them to pay attention to passive consumption. That means they're just scrolling. Building offline social networks and encouraging them to find supportive online networks. And just to say, I know we talk a lot about negative things. These are some of the positive quotes that we've seen from young people about their social media use. So there was one person I interviewed who said, their parent was really accepting of them being gay, and they said, well, at least this online community agrees with me. And I was like, maybe my parents don't agree with me, but they do. It can help with social engagement. It can help distract from negative feelings to find positive content. And peer support, you can easily text someone. And then one young person told me, when they were on Tumblr, they would say, I was thinking suicidal a little bit, and I got people saying that you have things to live for, and it's really nice and helpful. That's not always the scenario. Sometimes people are unhelpful, but sometimes this young person told me they wouldn't have told anyone else. So it was something they could get. And so just to kind of wrap up, I'm going to give some resources, but just in terms of an approach. So we used to think as physicians, okay, we need to find the risks. What are they doing wrong? But actually thinking about adolescence as an opportunity and in a strengths-based way, like what can these young people do? These are examples of young people who really made a difference when they were young, and thinking how can we help them take some of those healthy risks. So positive youth development is thinking about, okay, all youth have strengths and we can help them develop these strengths. And by focusing on some of these things, it can be really helpful. So one of these, there's these 5 C's, and thinking, okay, competence, feeling like you are really good at something, you develop some strengths. And so allowing that person to maybe take on a role in the home, learn a skill, do something for themselves or the family or the community, they can feel like, hey, I'm actually really good at this thing, whatever it is. Helping them feel more confident, so they feel like I am able to overcome challenges, and look at me, look what I've done, reflecting on that. Showing that they care. So sometimes if they feel really negatively about themselves, but they can show a pet that they really care for them, or they can go volunteer somewhere and show other people, and other people feel like that they cared for them, that can really help them feel good inside. Developing character, you know, learning more about their cultural, their racial or ethnic identity, understanding some of those morals, communities they belong to, religious communities, that can be helpful and build character. And then connection, which has been so hard this year, is really, really important to teens. And it's one reason we think teens are having difficulty this year, because of that lack of connection. So just to close, before we have questions, I want to share some resources. One of them is healthychildren.org, which is from the American Academy of Pediatrics. And it's really a way us pediatricians are trying to reach out to parents to provide them with resources. There's one article about teens and COVID-19, but there's articles really about everything. And it's a really great resource. American Foundation for Suicide Prevention has a lot of resources for parents, teachers, and community about suicide prevention. So again, it's not something we want to talk about, but the more we talk about it, the less suicide there is. So it's something to kind of look into if you are unfamiliar with it. And then I am an adolescent medicine physician, and we have a website where we have information for parents called adolescenthealth.org. And we have a whole list of different resources that all of us have put together for parents and teens related to coping with COVID-19. And then this is a great website that talks more about building those strengths that I mentioned, called fosteringresilience.com. And I highly recommend some of the videos on there. And then this is another training institute, excuse me, to help talk about suicide, called QPR. And another one is mental health first aid. And there's also youth mental health first aid. So it helps educate people about mental illness and about suicide and how to intervene. And then there's a lot of online resources, and this is something that I talk a lot about. So it can be hard to decide which ones are actually helpful or not. And this is a helpful website called Cyber Guide, where you can actually look up, you know, for anxiety for a teen, which apps might be helpful, which ones are free, which ones do you have to pay for. As more and more of this stuff comes out, it's helpful to actually look to see what is actually helpful or not. And I wanted to lastly tell you about my research intervention. So for the past 6 years, I've been working on 2 websites. One is called SOVA, and the other one is called Why SOVA for parents. And anyone can access our articles. Now about 30 to 40% of them are written by young people themselves about their experiences with mental illness. And the goal is to take some of that positive stuff I talked about on social media and let young people share in a safe place that's moderated by my team. instead of, you know, them going online on social media and getting positive, but then also getting negative at the same time. So young people have really shared, like, this is how I've coped with things, and then other people comment and say, wow, this is really helpful to me. So it's been something that you can definitely share with your young people. If any of them are interested in writing for our website, they can, and then they'll enter a research study where we pay them about $10 to $15 a month if they contribute a post. And it's been something that we've actually seen increase things like feeling competent amongst young people that we've worked with. And then we also have this website for parents where we basically have 6 years worth of articles of things that we've written about, things that young people have written about, and then we feature them on the site so you can get kind of a idea of what young people might be going through with their mental health. And then when you click on mental health topics resources, there's so much stuff out there that's helpful. And we've tried to put it together in a user-friendly way so that you can find some of the things you might be looking for in terms of mental health resources. So that's it. I made it 52 minutes. I had a lot of slides, so I wasn't sure if I'd get through them, but this is how to reach out to us. And thank you so much.
Anna, thank you so much. That was incredibly, incredibly helpful, and really just learned so much. We do have just a couple of questions. Going back to sort of the privacy and confidentiality of adolescents getting help through behavioral health. How does that work if you have a parent who knows their child has a critical mental health issue that needs to be addressed? They need professional intervention, and that 14 or 15-year-old over 14 wants nothing to do with it. Mm-hmm. Can a parent, sometimes we hear from parents, well, they're saying no, so there's nothing I can do because they're not going to consent to treatment. What can a parent still require a child to go to therapy? How does that work, or how do you suggest parents handle that if you have a teen saying, nope, I'm fine, I'm not doing it?
So the parent has, you know, every right to talk to a provider on their own. So just because what the teen says to their provider can be confidential, mm-hmm. that doesn't mean you as a parent don't have a right to talk to that provider and tell them whatever you want about your teen, you know, because you don't have to keep whatever is going on confidential. Right. So you can still partner with someone and a provider to help them help you. And so every situation is individual, right? So it's like hard to give a blanket statement, but sometimes what I might do I'll tell you all my shop secrets. So because I see people for medical issues, I might actually see them a little bit more often. So maybe they're having period cramps, and maybe if they didn't have the mental health issue, I would see them in like 6 months. Maybe I'll say, okay, well, let's check in about your period cramps in a month or two. You know, and maybe would it be okay if like we still talk about mental health? So maybe they don't want to see the therapist, but there could be an in-between step where they see me. And then I'll privately talk to them knowing what the parent told me, that, hey, you know, your parent has these concerns. I know you don't want me to talk to them about them. And it seems like you don't want to go get help. What are you doing to kind of help yourself out with these things? And then, would you be willing to check in with me in a month? And then maybe we reconsider this conversation if maybe you can figure these things on your own. That's great. Maybe that can happen. We do the same thing with like substance use and vaping and things like, okay, maybe you can quit on your own. That's awesome, or whatever that is, but let's check in more frequently. So you can use that. That's kind of how like a primary care medical home might try to be helpful. So it might not make sense like, oh, you know, to check in more frequently, but that's actually called watchful waiting, where you're seeing someone more often so that you can keep track of how they're doing. And then we'll use techniques like motivational interviewing with the teen. So it's really important, and you as a parent, that you can also ask, hey, because providers are busy, right? They're not going to think of it on their own, unfortunately. And we even have, limited space. Like we have to, get the parent in a private room and, maybe someone else using a room. But you can say, hey, can I actually talk to you alone? And you can express your concerns so that the provider can be more aware of what's going on and understand maybe there's higher severity here and maybe I need to help out. Another thing you can do is think where are other adult eyes on my child? So you can also work with the school and sometimes schools have mental health resources and the young person might be more willing to work with those school mental health resources because they're just on site. Right. So you could ask them, hey, would you involve my kid in the social emotional groups or things like that? Right. So it's really about persistence, I think, in getting some of those other supportive adults on your team to help you troubleshoot. I also like recommending Allegheny Family Network. So they're probably you're familiar with them, but they're a group that really helps to support families and parents. So there's other parents who've been through those situations who you can reach out to, hey, my kid refuses to go. What do I do? What did you do? How did you handle this?
Yeah. And with respect to social media, we talked about how having a positive relationship, positive environment with friends, family, and school sort of act as a buffer. What, as a parent, do you do when, I think it mostly happens with school, where school bullying and maybe in-person bullying is now seeping into, online bullying. And so it's coming, I always say when I was in school, to date myself, if there was any bullying going on in the school, when I came home, that was sort of a respite then. That was done. I wasn't seeing that person. There was no engagement until the next day. You sort of get a break. Right. And that's not the case always now. Yeah. So as a parent, how do you help maintain that protective factor when there may be some seepage from online into real life?
Yeah. So that's super important point. Even despite the school, the family being supportive can be helpful. So you have some hopefully control of your family environment to offer that support despite the school. Now, if the school is not doing any kind of anti-bullying programming, that's what I was showing on the stopbullying.gov. It lists every state and what the law requires. So the law actually requires the school. So if you feel brave and you want to advocate for the school, you can ask them, what are you doing to comply with this law? And, alert them to what's going on with the bullying, take pictures, screenshots, things like that. Another thing is, unfortunately, sometimes that's a very difficult situation. And it can be helpful to involve the child in maybe other groups where they can be with youth who are helping them in a supportive environment. So whether that's a sports team, a religious group, Boys and Girls Club, somewhere else where they can, and sometimes it's online helpful, supportive environments, because it's offering them evidence that this might be a difficult situation, but this is not all of the world and all of the possible reactions, relationships you could have.
Right. That's really helpful. And then finally, just one more question. From that developmental standpoint as a parent, sort of at what age, is there an age that is too young for kids to be exposed to social media? How do you sort of start that before they have their own Facebook account or whatever they have, if they're doing TikTok, however they're handling it? How early as a parent do you start talking to them about it? Do you give them little, opportunities to kind of learn safely how to set their own boundaries? Do you have any recommendations for that?
Yeah, so on healthychildren.org, I don't have the direct link for this, but there's a family media use plan.
Oh, great.
Because it's individual to every family. So
Right.
what the American Academy of Pediatrics have developed is this kind of intake, like you say, okay, how old is my kid? And then you enter some other information about yourself. And then it helps you put together this family media use plan of what are you going to do, what's okay to expose them to for what ages. And they're basically trying to keep that up to date with what we know the latest science is. Also, another really awesome resource is commonsensemedia.org. That has really great information for parents. I don't think there's, a perfectly right answer. I think one of the most helpful things, which is also super difficult, is navigating that online environment together. So especially if the kid is starting to use social media, saying like, hey, let's do this together, or hey, can you teach me how to do this, is probably the best thing, because then you can offer these learning points like, oh, hey, you see how this person said this? That's not that nice, is it? Or why did this person say that to your friend? Seeing as in COVID, people are working from home, and sometimes the only outlet is to give the kid the screen so you can do whatever you need to do. It's really difficult to do that. And also, like, it's harder to see, what are they actually doing on that screen. So there are different, apps and tools that different companies are providing, like Bark, securely for parents to monitor what their kids are doing online. But I definitely, like, that question is constantly changing. So I definitely recommend that Family Media Use Kit and Common Sense Media.
Yeah, those are great. Those are great suggestions. All right, let me just check. I think those are all the questions we have. So once again, I want to thank Dr. Radovic for joining us. That was so incredibly helpful and just a wealth of information. We really appreciate it. I also want to again thank our sponsors, NAMI Keystone Pennsylvania, Highmark, Blue Cross Blue Shield, and Allegheny Health Network, Kenny Ross, and the Wilson Group. And thanks to all of you for being a part of our Parent Up Pittsburgh program. We hope you have a great evening, and hopefully we will see you again when we introduce our next Parent Up program. So thank you all so much.
Thanks for having me. I really appreciate it.
Oh, thank you so much. Have a great evening.
You too. Bye-bye.
Bye.